Healthcare costs in this country are skyrocketing, reaching nearly $3 trillion in 2010. That's 10 times the amount in 1980. But the Cleveland Clinic is bucking the trend, thank you very much, improving care while saving money.
Dr. Toby Cosgrove is the clinic's president and CEO. Welcome.
Nice to be here, Charlie.
So tell me what you believe is wrong with healthcare, because I talk to people like Michael Porter. He says it's value, not getting value. Stephen Brill has a piece in the Time magazine.
Yeah.
He says it's a question of overcharging across the board.
Well, the problem is that we have a healthcare system that was designed for the 1950s. And now we're in the 21st century. And we have to change because the diseases have changed, the treatments have changed, and we need to have a system for delivering care. And we have no system for health care. We have a system for taking care of people who have disease, not a health care system.
And the difference is?
The difference is that we really have concentrated on making people well after they get sick. And we're very good at that. We're not very good at keeping people well over the long haul and having a system that's efficient and integrated across the entire United States and keeping the cost down and doing away with the duplication of services, et cetera. We're getting what we pay for.
And one of the things you all are doing over there at Cleveland Clinic is putting doctors on salaries and a contract. How are doctors normally paid?
Well, for example, I have 37 one-year contracts.
You're under salary and contract,
I am.
too.
All of us at the Cleveland Clinic are. And we have one-year contracts. It's a straight salary. There's no pay for doing more or doing less. And it didn't make any difference as a heart surgeon whether I did 2 operations a day or 4. I took home the same amount of money. Now, that's not true every place. So the incentive is not to do more or to order more tests. The incentive is to do just what the patient needs.
And then how are they judged? How are the doctors
Well,
judged?
we do it on looking at their contribution to the Cleveland Clinic in terms of taking care of patients, about writing, about teaching, about researching, the entire contribution. And we look at it every year.
You guys set a goal to save $100 million a year.
Yeah.
You've done it.
Yeah, we have.
You're doing it. How are you doing it? How is it a model for other hospitals across the country?
Well, we think we've got to look at every step along the way. For example, we've asked everybody to look at what they do, whether they're doing an operation. For example, what kind of sutures do they use? It turns out that you can take a silk suture and close up a wound for $5. And you can take a stapler and close the same wound for $400. So we've been able to take the cost of a prostatectomy down, for example, 23%.
A what?
Taking the prostate out.
Okay.
And we've been able to take the lung transplant cost down 10 or 15% by looking at all the details, all the fine things that we do along the way. And we think we got to keep people healthier.
Okay, there's also the, go ahead, Lou.
Well, I was just going to say there's no detail too small, too. I mean, you also had the gowns redesigned at Cleveland Clinic. Yeah.
Yeah, well, we think that when you go to a hospital or a healthcare system, there are really 3 things that count on quality. 1 is the clinical outcome, 2 is the emotional experience, and 3 is the physical experience. And we thought it'd be very nice if we had something that actually was decent to cover you when you came into the hospital.
Not those things where your backside hangs out.
Exactly.
Yeah.
And Diane,
That's a good thing to get rid of those.
Darn right.
Thank you.
There's also this, the administration, a signal achievement in 2000, in the first administration, the first term, was healthcare reform. What happened? Why didn't they get the kinds of things that you're suggesting?
Well, what they started out to do was to try and do access, quality, and cost.
Right.
And they did a great job on access. They brought another 30 million people to be covered from insurance. And they are doing better and better job about quality because we're reporting quality and being very transparent about it, which we always have been. But if they have not done a lot to reduce the cost of the care across the country, and costs are going to continue to go up. So we've got to change how we do it, and the whole system is changing across the United States.
If you look ahead in terms of America's debt problem, the biggest single item is health care. If you don't do something about health care, you can't do anything about the debt.
Exactly. 2/3 of the cost of the debt of the United States is healthcare and healthcare related. And so we have to do something about that. And one of the things we need to do is begin to have people stay healthier. Smoking, obesity, now 1/3 of the United States is obese, and that leads to increase in cancers, increase in orthopedic problems, increase in the incidence of diabetes. So it's a huge issue that we really have got to come to grips with.
Yeah, because you say we are our own worst enemy. We, the people, are our own worst enemy.
We got to take responsibility for how we are. We can't live any way we want and then turn around and say, take care of me.
Doctor, help me.
Yeah, exactly.
Thank you, Dr. Toby Cosgrove.
My pleasure.
Our pleasure.